Hi everyone, it's Rena Jadov with Dr. Peter Osborne talking about the book masterclass on No Grain, No Pain. And we're talking about how to pick the right doctor. Dr. Osborne, so where do you start? Where does a patient who says, I'm so full of pain, no one can diagnose me, and I have friends, kids who are in that state right now. What do you recommend? How does someone go about finding the right doctor to help them?
You know, that's a tough question because in functional medicine, there are a few major training programs across the United States. There's no official residency for doctors. There's no official internships for doctors. So it's all pretty much done postgraduate. And so what you're looking for is first of all, you're asking around with family and friends. Who do you know? Who's got a reputation? Who has actual past clientele or past patients that can speak on that doctor's behalf, because nothing speaks louder than results.
Yes.
Secondly, we definitely want to see what kind of training the doctors have. In medical, training is not a necessity. A lot of people think medical doctors are smarter. A lot of people think that medical doctors are somehow better educated. And disclaimer, I'm not a medical doctor. I'm a chiropractor. I'm a doctor of pastoral science. I'm board certified in clinical nutrition. And so, you know, that disclaimer. So I'm not a medical doctor, and I'm not saying that medical doctors are bad or that there aren't smart functional medicine doctors that are medical doctors too. It's just that the training for a medical doctor versus, let's say, the training for a chiropractor or a naturopath is vastly different in the sense of natural medicine. And so a medical doctor is actually at a disadvantage unless they go to school a lot longer in a postgraduate fashion to get that experience and to get that education, because it's not at all taught in medical school. Nutrition is not even a class that's taught in medical school. The average doctor gets less than 7 hours of nutritional training.
Yeah.
And the 7 hours that they get is not nutritional training. It's anti-nutritional training. It's how bad is nutrition? It doesn't really do much, so don't worry about it so much and make sure. No, I'm serious. That's the training that most medical schools have. So understand that if you're seeking a medical doctor because you have this false belief that somehow a medical doctor is somehow better versed in functional medicine, you might be looking in the wrong location. That being said, there's some great medical doctors who are also functional medicine doctors. So look for doctors trained in functional medicine, and that will usually be somewhere on their website or somewhere in their name, right? If you look at the initials behind their name, some doctors will make a claim that they're certified through Functional Medicine University. It's one of the places I went. I also went and got a diplomate with the American Clinical Board of Nutrition. Some doctors will claim expertise through the Institute for Functional Medicine or the Institute for Integrative Medicine. So there are different training programs that are out there. So just make sure that the doctor has gone through one of these training programs. And then the next one is, the most important question to ask is, because the doctor could be in practice 30 years, but 25 years into practice, they decided to do functional medicine.
Right.
Don't base the length of time the doctor's been in practice, and don't make the assumption that all of those years of practice experience are functional medicine experience. Because a lot of doctors are jumping ship from medicine onto the functional medicine side, and they're brand new at it. They're green behind the ears, and they may not be the most experienced. And that, you know, look, everybody has to start somewhere, right? But if you're chronically ill and you're looking for somebody who's vastly experienced, then the question that you want to ask is, does the doctor have functional medicine certification?
Yes.
And how long has the doctor had that certification? And how long has the doctor been implementing functional medicine in their practice? Because there's some doctors who are certified in functional medicine. I have one next door to me who don't practice functional medicine. So they have the certification, but they don't really practice by it. So it's important. This is why it's important to ask a neighbor, ask a friend, ask a relative if they know someone. Because honestly, in the entire country of the United States, I could probably say there are somewhere in the neighborhood of 400 to 500 functional medicine doctors that are good and experienced that actually practice functional medicine. So there's not a lot of them. No.
That's a really small number. Is that directory available somewhere so someone can say, look, I don't have any friend that knows any functional doctor. What do I do? Where? And to your point, that was me 2.5 years ago. And they said, well, go to the website, the Functional Medicine Training Institute's website, and you'll find a doctor there. But there's so little information. There's nothing curated which says, hey, here's exactly what you just said. Here's the 400 to 500 doctors that are available and you can trust them because they've actually been practicing. Where is that information?
There isn't a place. There's no accumulated place. I mean, I train doctors in postgraduate. We actually have doctors coming in next week to shadow me. And so what I try to do is I try to have a place of, and it's my foundation, glutenfreesociety.org. There's a tab at the top that says doctors.
Okay.
And if you click on that, there's a map. And so we try to map some of the ones that have come through some of our training. But even with that, so just that you know, even with that, just because they've come and done some training, it's still, you still want to ask those questions, because a doctor can do the training, but if they don't apply the training, then they don't gain the wisdom and experience from the application of the training. And that's what makes a doctor great, is the application of knowledge and the gaining of experience from that application. Because, you know, the old saying, knowledge without application is useless, right? So you can go through a training program, you can read a book on how to rebuild a motor, but if you've never rebuilt a motor and you have no experience with motor building other than the book you read, you're not going to be very good at it in the real world when variables occur, right?
Exactly. No, that's so helpful. And maybe at some point you'll consider creating that directory. But with that said, for the rest of you that are listening, and we are going to be doing the next chapter, which is a combination of the days 1 to 15 and 16 to 30. So make sure you tune in. We'll see you on the next one.